So Andrew, might you have any advice for some of the caregivers that are out there with regard to dementia, and specifically with regard to dealing with hallucinations and delusions?
So hallucinations are particularly common in a disorder called dementia with Lewy bodies, which is very similar to Parkinson's disease dementia. And these individuals tend to have symptoms of Parkinson's, such as shaking, tremor of the hands or head, or sometimes other parts of the body. They can act out their dreams at night. And most concerning to families, they can have hallucinations, often of people or animals. And early on, the hallucinations don't tend to be frightening, and the patients are generally aware that they are hallucinations. So they might see a little girl playing in the corner, or they might see, a dog, rolling around on the floor, or something like that. And it's often very frightening to families, even though it's not frightening to the individual themselves. If that's the situation we're in, my number one advice to families is relax. Don't worry about it. Don't let it distress you. It's not worth really doing anything about if it's not bothering the patient. I would simply recommend that if the individual starts talking about seeing someone who's not there, just engage them in conversation, shift them to a real actual event that's going on. Tell them about your day, or ask them a question about something that they know something about, or something like that. Now, if the hallucinations are becoming more common and the individual begins to not be able to distinguish the hallucination from reality, and particularly if they get a little bit frightening, then we want to start to address them with medications. And the first thing we want to do is use one of those medications that can turn the clock back on Alzheimer's. And that would be something like donepezil, brand name Aricept, rivastigmine, brand name Exelon, or galantamine. And generally, that actually does help the hallucinations to go away for at least 6 to 12 months. The next thing that I would try, if the hallucinations are still present and still bothersome, meaning it's bothering the individual who's seeing them, not the family, but the individual, is I would try a medication that makes them feel a little bit calm, an antidepressant or anti-anxiety medication like sertraline, brand name Zoloft, escitalopram, brand name Lexapro. And then finally, I would use one of these more powerful medications that can cause serious side effects and does have risk of strokes and death, but sometimes it's necessary. And this would be medications like risperidone, brand name Risperdal. So that's hallucinations. Now, delusions are a little bit different. So a delusion is a fixed belief in something that is not true. And the most common type of delusions are paranoid delusions. So people may feel that someone is stealing from them, or someone is out to get them. They may have a delusion that their spouse is having an affair. All of those are common delusions. And delusions can happen in any type of dementia and are particularly common in Alzheimer's disease. And one of the reasons that they're particularly common in Alzheimer's is delusions tend to come if you can't remember things. So, your spouse says, "Oh, I'm going to run down to the corner store for 10 minutes and, pick up a newspaper, I'll be right back." And the person with Alzheimer's can't remember that their loved one was just going to the store, and to them 10 minutes can seem like 10 hours when they don't know where their spouse is. And they start creating fantasies in their mind, that may be based on, old fears or something like that. And their spouse comes back after 10 minutes and says, "Hi, I got the newspaper." And the person with Alzheimer's may say, "Where have you been? You've been gone for hours. I didn't know where you were. You were having an affair, weren't you?" Even though, that's all completely untrue. So delusions can happen with that. When those happen, what I recommend are what I call the 4 R's. So we want the person to reassure the loved one that everything is okay. We want them to reconsider things from the loved one, the person with Alzheimer's perspective, which is the fact to sort of think about the fact that because they have no memory, they're not able to recognize that Eve was only 10 minutes. Redirect the person to activities or topics of conversation that are both distracting and calming. So get them talking about something else. Play a little music, turn something on TV, look at an old picture album, suggest maybe let's go in and have a snack. Anything to redirect them away from the paranoid discussion. And then finally, the 4th R is for all of us caregivers to take in a deep breath and relax. Because if we are, upset or irritated or frustrated or anxious about our loved one's behavior, we may mirror that, reflect that behavior back to them and actually escalate the situation. Now, if these non-pharmacologic things can't work, I would again recommend that same 3 classes of medications to be used in order. If they're not already on a medication, to turn the clock back on the Alzheimer's or other dementia, I'd recommend that. Those are medications like donepezil or Aricept. Then next medication to help them feel less depressed, less anxious, things like sertraline, brand name Zoloft, and finally medications that can really help to suppress the delusions, things like risperidone, brand name Risperdal.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.